We search for drug information from package inserts, lexicon, macromedics, and clinical pharmacology. We identified the drug interactions and we checked for compatibility with IV drugs. Now, let's search for disease information by using DynaMed and UpToDate.
So if you go back to the one portal and if you go under apps clinical desktop, so under clinical desktop, you can basically get access to DynaMed. So the DynaMed Plus, if you click on the icon, it will open DynaMed. As long as you are on the Loma Linda network, you will have access to it. And then, instead of drugs, you can search for disease state. So let's say you wanted to know how to treat urinary tract infections. So you click on it, and then it takes you to this topic of cystitis and upper urinary tract infection in men. And on the left side, you have this table of contents. So you can, depending on what you're looking for, this is especially useful if, you're doing a case presentation and you're looking for information like epidemiology. So if you click on epidemiology, it takes you to this section so uh, you can get the information. You can also get information about diagnosis. So there's, information about diagnosis, information about um, how the person would present as far as chief complaint. So, this will be the chief complaint that this patient would have. And also, uh, you can get information on the physical. So what would the physician find on physical exam? You can see them listed here. And then of course there's also information for diagnosis. What's the diagnosis of a urinary tract infection, and also information about treatment. So remember that this is a tertiary resource. So this is a good starting point if you are to use this for your case presentation. And then you should use this to direct you towards a more primary literature. So as you know, this should give you like an overview of the disease, and then once you get to the treatment, then you want primary literature to support specific treatment. So if you are to use, for example, levofloxacin, you should look for primary literature that supports this recommendation. And sometimes DynaMed will tell you the references. So, you might come across reference like this one. So you can actually check out some of the references, and that will also lead you to some primary literature. Now, one thing that's important, you should not use DynaMed or UpToDate as a reference on your slides when you present. You can use this, to guide you to the primary literature. So, for example, if you looked, you can use DynaMed to, come up with some ideas about treatment and then, use the references on your slide. But it's not a good idea to use DynaMed itself as a reference because DynaMed changes frequently. So if you put it on your slide and then somebody wants to verify your source, what you said may not even be on DynaMed anymore just because somebody updated it, and it may make you look like you were lying about where you got your information. The same is true with UpToDate. UpToDate gets updated frequently, so it's kind of like Wikipedia, except there are physicians who are actually updating it. So you can use the information on it and see what references they use to get that information, and then you can cite those references on your slides rather than UpToDate or DynaMed itself. One other thing that's really good with DynaMed, if for this disease state you don't know what guideline to use, and I will talk about guidelines in more detail on a later day. So it has a guidelines and resources section. So if you click on it, uh, it will take you to the guidelines. So it will tell you in the United States these are the guidelines, and it also gives you reference to it. So you can actually pull the guidelines. So if you ever come across a disease state and you don't know what guidelines to use, one shortcut is to go on DynaMed, type the disease state, and then go under guidelines, and then it will actually give you a link to the guidelines, so you can locate the guideline very quickly. Now here's what UpToDate looks like. So once you go, if you happen to have access to UpToDate, this is what it will look like. And you can basically search for your disease stage. So if I say urinary tract infection, it will give you all the topics that are related. So you can see, for example, let's see, acute complicated urinary tract infection in adults. So if I click on it, it takes you to here. So it will tell you. So it's kind of like a Wikipedia page, except it tells you the authors are, MDs. So these are all MDs that have put this together, but they update it frequently. So they can go on this page and remove things or add things. So, it's not a good reference on your slide because the stuff may be removed, and then whoever's trying to verify your source, they will not be able to find it. But you can actually use, so if you found the useful information here, they will tell you, see, they give you all the references. So you can click on the references and they will take you to PubMed, and then you can use that as your reference. So it's a quick way of finding primary literature. So UpToDate is considered a tertiary resource. Go back. And then the things that, so it always has an introduction section. It has some terminology that it talks about, and then there's a microbiology section. There's clinical presentation. There's information about diagnosis. There's information about management, so treatment and follow-up. So it's a really nice resource that will give you answers very quickly. Um, but just be careful that although it says up to date, it can get outdated if, because it's really up to these authors who updated it. It's up to these people to make sure that it's up to date, it stays up to date. And it tells you like this topic last updated April. So since April, it's August right now. So between April and right now, actually they tell you literature current through July. So if since July, between July and August, if something was published, it's not in this article. So just be careful when you use this resource. And finally, the last learning objective is locate medical books on StatRef and clinical key to address a clinical question. And I kind of showed you how to get to StatRef and how to find handbook on injectable drugs. Let's see what else we can get on StatRef and also what books are available on clinical key. So once you get to StatRef, you can see a list of titles on the left. So you can, kind of navigate through and see what books are useful to the topic that you're researching. One thing that's available here is the AHFS Drug Information 2018 edition. You also have access to compounding sterile preparations, concepts in clinical pharmacokinetics is a nice resource for pharmacokinetics. It has information on vancomycin and aminoglycoside and some other drugs. You also have access to stability of compounded formulations and also the Washington Manual of Medical Therapeutics. From one portal's clinical desktop, you can also access clinical key. So if you click on clinical key, it will take you to their website, and there you can actually search, for books. So if there's a book that you're looking for, you can actually look for it. So let's say if you were interested in a book in infectious diseases, it will give you this book. So this is Mandel's. So you can actually click on it and it will take you. So Mandel's principle and practice of infectious diseases is considered the Bible of infectious disease. So if it's very comprehensive and you can actually access through clinical key. And then if you click on books here, you actually get the alphabetical listing of all the books that are available. So you can browse through these books and see which one is relevant to the question that you have, and be able to find the answer through that book. This concludes this presentation.